additional tests that we would do if we found any abnormalities on a physical exam would be like we would do RADS, radiographs, if a dog came in limping, if the doctor palpated the abdomen and felt something that felt abnormal, or like a mass or possible foreign body, then we would do x-rays on it if they were showing signs of vomiting, diarrhea, things like that. We'd also run blood work if a dog came in lethargic, jaundice, showing anything not normal. We would run blood work to see if there's an underlying cause or disease going on. An ECG we would run. We've had patients come in, cats come in panting, the respiratory rate is really high, they seem like they're breathing really labored. We could run an ECG from there. So effective pre-anesthetic and anesthetic protocol we would do, usually discuss with the doctor. With our patients here, we do ACE promazine injection to sedate them and calm them down, so that we can place the IV catheter, so that we can scrub and shave effectively. We also do a Medicam anti-inflammatory injection to help with pain, and also mixture of buprenorphine with the ACE. Also an effective pain management. For our older patients, we do the propofol. We do that a lot with our dentals. It allows them to wake up quicker. And then for our younger spay and neuters, the doctor likes to do a mixture of the the midazolam and ketamine. It kind of allows them to, it's more pain effective. It allows them to wake up a little bit slower, so the recovery is not so rough. So these are the discharge instructions that we print out to give to the owner. We discuss it when they come pick up after the procedure. It explains the owner's name, patient's name, age, sex, weight, breed. There's home care instructions at the beginning, we let people know that they may be tired for the rest of the night. We tell them to offer a small amount of water first to see if they can keep that down. And then when they do offer a small amount of food, we usually say feed them less than they normally do, because we want to make sure that they can keep it down. We do tell them that it's normal if they're not interested in eating. We want to let them know in case they get concerned that their dog's not eating the next 24 hours, but we explain that it's normal. If they're not thirsty, we also explain that we do give them IV fluids during the procedure, so if they're not thirsty, that's also normal. Exercise restrictions. We usually recommend no running, jumping, climbing for the next 10 to 14 days. We want to make sure their incision doesn't open up. Feeding, if they need a prescription diet, or if they can feed their normal food, which most patients, unless directed otherwise, can feed their normal food when they get home. These are all the prescriptions that go home with them. This was a spay, so she got some Medicam single dose syringes, and so we tell them to give one syringe once daily until gone with food. Start that in the morning, and we make sure to tell them that when it says with food, to make sure that they have plenty of food in their system before giving it, because it can cause some GI upset. Wound care, we tell them that they have an incision, keep it dry, clean, no swimming or baths, do not apply any medications unless directed to do so, do not allow them to look at their incision. It can cause it to get infected, to get swollen, and if this does happen, to contact us immediately. We recommend that they use an e-collar if the dog is not going to leave the incision alone. But if any of this occurs or the site opens, to call and let us know immediately. There's options for if they need a suture removal or no suture removal. For this specific patient, they did not, because we explained that the doctor used removable sutures. At the very end, we have our phone number if the owner has any questions. Side effects could be, you know, the medications, pre-anesthetic meds, and the anesthetic meds can make the patient really sleepy, really groggy. There is a chance that patients can vomit, but if it happens multiple times, we tell them to let us know. If any diarrhea occurs, anything like that, anything abnormal, we have them contact us immediately just so that we can make sure that the dog is okay and that nothing is out of the ordinary. For our controlled drug entry log, what we do is, here's the pre-anesthetic form that we do during the procedure. So any meds that we do that day that are controlled, we write them down and how much we gave and where. And then we go into their PVL and we will specifically type in, if we did buprenorphine, we will specifically type in from the injectable bottle, exactly how much of it we gave. And then it'll automatically update in our system and let us know how much of that we did, and it keeps track of it. Out of the kennel, you want to make sure that you approach from an angle, and you want to make sure you leave the doorway open so that they don't feel trapped, and use verbal reassurance and make sure to go slowly with them so it doesn't seem like you are coming at them really fast. This is an endotracheal tube. It's used to transfer anesthetic gases from the anesthetic machine directly into the patient's lungs. This is a cuff, so you'll push some air into it and that will blow it up right here. If there is a leak, sometimes you can hear like a hissing kind of noise. The breathing in the patient sounds a little bit differently. It almost sounds like air from like a balloon is being released. And so sometimes that means there is a puncture wound or something going on with the tube, and then usually we'll replace it with a different tube. This is an anesthetic mask. It delivers oxygen and gases to non-intubated patients via the mouth and the nose. With this machine, we have the compressed gas supply that supplies carrier gases, our anesthetic vaporizer, vaporized liquid inhalant anesthetic, and it mixes carrier gases with it. Our breathing circuit conveys carrier gases and inhalant anesthetic to the patient and removes exhaled CO2. The scavenging system disposes of excess and waste anesthetic gases. The tank pressure gauge indicates pressure of gas remaining in the compressed gas cylinder. It's measured in PSI. The flow meter, this can reduce pressure. It carries gas flow through the oxygen flush valve that you push right here. This rapidly delivers large volume of pure oxygen. Whenever you crank the knob, it'll go up and down. It can reduce and increase in the pressure of the gas. Our oxygen supply is kept in the closet. It is back there with the chain wrapped around it to keep it in place. That's our extra oxygen. And the ones that we are using are hooked up to the machine. So we have two of them. We keep one full and one empty, and then whenever one becomes empty, we replace it with one of the ones in the closet. So we have our ECG machine here. We have our pulse ox, and this measures the oxygen level in the blood. We have the temperature probe, and with this you just lube it up and stick it down the animal's esophagus, and it measures the temperature of the patient's body. We have our blood pressure here. It measures the movement of the blood in the body. Our ECG lines right here. This measures the electrical activity of the heartbeat. Our esophageal stethoscope monitors the heart and lung sounds of anesthetized patients. We do not have one here, but I will demonstrate using one on a patient using a red rubber catheter. The machine also shows respiratory rate, so however many breaths we're taking in a minute. When choosing an ET tube, they have the numbers on it for the diameter of the tube. So this is a 10, a 6, and an 8.5. To decide which one's best for the dog, you can usually look right here for the width of the tube, and you can measure in between the dog's nose and kind of estimate about how big the dog is and what tube you'll need for it. When the animal is in sternal recumbency, you can pull the animal's tongue out of its mouth. A gauze sponge, you can use that to prevent the tongue from slipping. Then you locate the larynx and depress the epiglottis, and then you'll pass the lubricated end of this into the trachea until the tip of the tube is about midway between the larynx and the thoracic inlet. If the tube is advanced too far, you can actually enter the right or left mainstem bronchus. But whenever it's correctly placed, you'll normally hear the dog cough, and you'll see this part of the tube fog up. To apply eye lube to the patient before going under anesthesia, you can open up the dog's eye with your thumb and your index finger, and then you'll place a quarter strip, and do not touch the actual eyeball with the tip of this lube. You could cause irritation or damage to the eye, but you'll just, this tip right here, but you'll just do a quarter strip onto the white part of the eye, not the cornea, and then you'll let them blink, and the warmth of their eye usually melts it down. When performing CPR on a patient, you want to go to the widest part of the chest. You can feel with the rib, the widest part. You're gonna have straight arms, and you're gonna push down about a half to a third of the way. And then the rate you want to do is usually 100 to 120. Okay, when wrapping a surgical pack, we'll have all of our instruments, our gown, and then our drape, and then our gauze up here. We're going to start by grabbing one of the corners, folding it over, making sure everything's tight. You're going to grab this corner and fold it back. You're going to take each side corner and fold it over your pack, and then fold it back like this. The next corner you'll use to fold over with this little triangle folded back. Next you'll grab this last corner and you'll fold it in just like this. And then you'll do the same with the other drape. With the surgical gown, you'll wrap it the same way. You've got the sterile towel on top to wipe your hands off whenever you are done scrubbing. And then the gown on the bottom, the doctor will grab using the armpit area. He'll reach for that first. Then you'll wrap it the same way with every corner. You'll wrap it back, leaving a small triangle. And you'll usually leave a little, the tip of the triangle out. This will be sterile. That is what the doctor will pull on to open the pack. Once this pack is done, you'll grab a piece of indicator tape and then you'll stick it into the autoclave that we have right here. We have some additional packs in here right now. So you'll stick it into the autoclave. You'll close it. There's an option for packs. You'll press that and hit start. Now that the pack is done, you'll know the indicator tape will turn the darker color compared to what it looked like right here. That's how you know that it is sterile. For sterilization of surgical packs, exposure to saturated steam at 121 degrees Celsius or 250 degrees Fahrenheit for 13 minutes is considered to be the safe minimum sterilization. Should I go in?
Good job, Meow Meow.
Get through her hair.
Good job, Meow Meow.
Just hold that up. Performing a physical exam on a canine, you use TPR, so you can get a temperature by lubing up a rectal thermometer and sticking it slowly into their anus. You can palpate their pulses by way of the femoral artery, which is located on the high medial thigh. You can apply digital pressure with the tips of your fingers, and you can calculate the pulse for 15 seconds and then multiply it by 4. The respiratory rate you can obtain visually, then by auscultation to hear. If you have a stethoscope, you can listen to the respiratory rate, or you can visually watch it, see how many breaths they're taking in 15 seconds and then multiply that by 4. You can view the oral cavity for dental disease. You can just slowly lift up their lip. You can feel the mucous membrane, see if they're pink. Check the teeth. The eyes, you can assess visual status. This is to check for any ulcers, any discharge, cataracts, things like that. The ears, you can check the pinnas for swelling, alopecia, crusting. If you have a otoscope, you can go in there and evaluate for thickening, swelling, masses, or discharge. Abdominal palpation, you can use your index fingers and slowly palpate the abdomen. Feel for any thickening, masses, something abnormal that doesn't feel like it belongs. rectal examination is usually performed in patients only with presenting complaint to the rectal area. The rectal wall can be evaluated for irregularity, thickness, masses. The integumentary system, you can check their hair coat, their skin, see for any crusting, scaliness. Lymph nodes you can feel. See if they feel enlarged or abnormal at all. And then you can check the musculoskeletal system, see if there's any pain or swelling. You can do extension and flexion of the muscles, range of motion. Okay, so to get a rectal temperature, we would lube up the thermometer and slowly slide it into the anus. Okay. So here's our saphenous catheter. Just let it record and I'll just edit this whole part out. Okay, scrub it. Alcohol. Okay, you can hold it off. It's fine. Squeeze it, look her down here some more.
Oh, you're standing in front of your camera. There you go.
Okay. That one. Just like hold it so. We'll flush it out. It's in. Then we'll bandage it. Okay. Break a sterile field or sterility. You want to make sure that your arms are above your waist. don't put them down because that breaks the sterile field. If you're going to be walking, always walk with your front by the surgery table. The back is not sterile, so that would break sterility that way. If you have to cough and you have a mask on, it's best to cough forward. If you try to turn your head away, it's just going to go out the mask. Any drapes that get wet are considered unsterile.